Salam, may the peace and blessings of Allah be upon him. He is the messenger of God. We thank Allah for the life of our dear father, Major Kehinde Danmole, who is 80 years old today. Say Alhamdulillah, 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 Rabbil Alameen. All praises to Allah for his life. Many of us who have known him for more than 50 years, we know that Allah has truly been merciful to him. He's been a gallant soldier during the Civil War. He's had many ups and downs, as is normal for any human being. But we know that his creator has been merciful to him. In our environment, it's not easy for someone like myself at nearly 50 to give a commendation to a nearly 80-year-old man. We know what our environment is. Many of our elders have disappointed us. But I can attest to Major's outstanding character. He's extremely kind, extremely loyal, consistently straightforward, and a man of outstanding integrity. This is very rare, as you know, in our environment. May Allah continue to reward him for his good. The mistakes that he has made, or he may have made, may Allah forgive him. I say, Allahumma nakafu tu'ibul afwa fa'fu. Allahumma nakafu tu'ibul afwa fa'fu. Allahumma nakafu tu'ibul afwa fa'fu. May Allah forgive him of all his sins. The ones that he did deliberately, or he may have done by mistake, may Allah completely forgive all his sins. For my dear sisters, Olalunke, and our outstanding professor, Olaito, and the entire family, we pray that Allah should continue to guide and bless you all. Allah has used you to give peace and joy to our Father. May He not have cause to be disappointed in any of you. May you all continue to thrive in the blessings of Almighty Allah as one unit under the guidance of the one true God. For the lecturer that we're about to receive, Dr. Shonibare's, your reputation precedes you, sir. Just to think that a few weeks ago, someone was mentioning your name as a foremost authority on this topic. It's outstanding that I'm now here before you, with Allah calling you into this and Major Danmole arranging this event. We're really, praiseworthy and thankful that you are here with us today. And for this terrible pandemic, may Allah save us and forgive all those who have lost their lives. We beg Allah to stop the spread of COVID-19. We shall all gather again to rejoice and celebrate very soon the end of COVID-19. And of course, our country, Nigeria and Lagos State, we pray for continuous progress. We pray that the insecurity in the country will come to an end. We pray for prosperity, and we pray for the golden days when Nigeria was truly a country to be proud of. My sisters have requested, and the organizers have requested, that we have a minute's silence for Major's late sister, Untitled Danmole, who would have been 80 years old today as well. We Muslims have a way that we pray for our dead, but I will say, let's have 1 minute of complete silence in memory of late Untitled Danmole, and then I will ask others to join me in opening the prayer time. 1 minute of complete silence, please. Thank you. Bismillahir Rahmanir Rahim. Qul huwallahu ahad, Allahu samad, lam yalid wa lam yulad wa lam yakul lahu kufuwan ahad. Bismillahir Rahmanir Rahim. Qul huwallahu ahad, Allahu samad, lam yalid wa lam yulad wa lam yakul lahu kufuwan ahad. Bismillahir Rahmanir Rahim.
This is the lecture. It's not started the lecture. So just give a prayer and then please start. This is what I was still saying.
ربنا اخذنا صبرا كصابنا من فانزلنا وتعالى ربنا ولا تحملنا ولا تكلنا به واعفنا واغفر وارحمنا انت مولانا فانزلنا على القوم الكافرين ربنا اتنا من لدنك رحمة وهب من امرنا رشدا ربنا اخذ علينا صبرا وتوفنا مسلمين آمين 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 سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين. Thank you very much for listening to me. I'll hand over back to the moderator.
Thank you very much, Sunday. Thank you so much. To enable us have a hitch-free event this morning, I would enjoy all participants to please keep yourself muted. You can leave your video on if you want to, and it will not affect your bandwidth, but please keep yourself muted unless you are asked to speak, please, so that we can have a hitch-free event. According to Cancer Research UK in 2018, there were 17 million new cases of cancer and 9.6 million deaths worldwide. 4 of the most common cancers occurring worldwide are lung, breast, bowel, and prostate cancer. It is estimated that worldwide there will be 27.5 million new cases of cancer by each year by 2040. But it's not all gloom, as most cancers can be prevented and treated if diagnosed early. However, clearly, I am not the expert. Dr. Shonibare, consultant urologist and kidney transplant surgeon, medical director, Vantage Medical Center, will present a paper on prostate and other cancers, symptoms, treatment, and prevention. But first, let me hand over to Dr. Taibat Lawansin to tell us about the foundation and its founder. Dr. Lawansin, over to you.
Yeah, so the Kehinde Danmole Foundation is a non-governmental endowment for education, healthcare, empowerment, and environmental sustainability. The aim of the foundation is to advance and support the well-being of all people of our world in all areas and fields of human endeavor, and through that, enable them to fulfill and actualize their endowments. Effectively, the foundation focuses on contributing to education, healthcare delivery, human growth and development, as well as the environment. The foundation was inaugurated on as a borderless and boundaryless non-religious, non-profit organization on August 8th, 2000, and obtained its charter on June 27th, 2005. We are celebrating our 20th anniversary today. It was founded by Major Kehinde Danmole as an avenue to consolidate his philanthropic work and as a forum to channel energies towards improving the living standard of mankind and the preservation of man's harmony with his environment. Since its inception, the foundation has organized public lectures on a number of issues and has collaborated with other organizations such as the Eco Club and the Australian Aid to organize eye screening tests, blindness prevention, drug abuse outreaches, as well as repurposing and equipping a computer laboratory at the Vocational Training Center of the Federal Nigeria Society for the Blind, Oshodi. The foundation has also instituted scholarships, prizes, and trophies at the Vocational Training Center of the Nigerian Society for the Blind, at the Wesley School for the Deaf and Hearing Impaired, at the Vivian Fowler Memorial College for Girls, and other educational institutions. Currently, the Kehinde Danmole Foundation is sponsoring a number of students at bachelor's, master's, and doctoral level studies in Nigerian universities. Our current efforts are geared towards a more impactful intervention in focus areas, including information and advocacy to promote health and well-being. Thank you.
Thank you very much, Olaito. We would also invite you to please read the citation of the founder.
Okay, our founder is Major Retired Kehinde Danmole, who is celebrating his 80th birthday today. He was born on August 8, 1940. He attended St. Paul's School, Breadfoot, Davy Street, Lagos between 1949 and 1956, and then proceeded to Molusi College, Ijebu-Igbo. A desire to serve his fatherland saw him choose a career in the military. He was given admission to the Nigerian Defense Academy as a pioneer officer cadet of regular course 1. He attended the Officer Cadet Military Training course between 1963 and 64 at the Nigeria Air Force Base, Kaduna. He served as a logistics officer at the Air Force Base in Kaduna until he traveled abroad to the Supply Officers, Supply Management and Logistics course in Germany, where he obtained a diploma. And on his return from Germany, he was employed at the Nigerian Civil Aviation Training Center as supervisor of stores. He was granted a direct commission to the Nigerian Army in June 1968 in the rank of full lieutenant. His regiment was the Ordnance Corps. He fought gallantly alongside other officers and men during Nigeria's civil war at various stations, including Abak, Ikom, Calabar, Owerri, and Port Harcourt. He was the commanding officer of 3rd Marine Commando, Ordnance Field Park, and Depot, respectively. For courage and gallantry in the service of his nation, he has been variously decorated with the Republic Medal, the Defense Service Medal, the National Service Medal, and the General Service Medal of the Federal Republic of Nigeria. Major Danmole, after the war, continued with his studies and obtained an advanced diploma in purchasing and supply management from the Commonwealth and Foreign Officers Ordnance School, Blackdown, Surrey, England. He's an associate member of the Royal Chartered Institute of Purchasing and Supply Management of England. After the war, he was posted to the Nigerian Army Central Ordnance Depot, Yaba, and retired in December 1975 as the commandant of the Nigerian Army Ordnance Technical Training School, or JOC Cantonment. Since retiring from the Army, he has channeled his energies towards other business interests, including real estate and the establishment of Kendam Limited, a toys and educational aid supply company. He retired from Kendam Limited and has dedicated his life to charitable work. Kehinde Danmole believes that life is not worth living if you cannot lend a helping hand. As such, he is involved in various philanthropic activities. He is Rotarian past president of Rotary Club of Surulere. He is a Paul Harris Fellow and an awardee of the Rotary Foundation of Rotary International. He served as a member of the Lagos State Expanded Program on Immunization and was chairman of the Polio Plus Committee for Lagos State. He's patron of the Boy Scout movement and trustee of the Deaf Blind Association of Nigeria. He has served as a member of the Board of Governors of the Atunda Olu School for Physically Challenged Children and the Wesley School for Deaf and Hearing Impaired Children. He's currently a trustee of the Vivian Fowler Trust Foundation for University Education, a member of the Governing Council of Hallmark University, Jebu-Itele, and a member of the Governing Council of the Vocational Training Center of the Federal Nigeria Society for the Blind, having served in various capacities over the years. Since 2000, Major Kehinde Danmole has been the chairman of the Kehinde Danmole Foundation, an endowment which he founded and devotes his retirement years to. He's the blessed father of 2 daughters and a son, and the proud grandfather of Olufumilayo, Olukayode, Olufolajimi, Olujimi, and Adesola. Thank you.
Thank you very much, Olaitan. If this were a physical event, I would have said that we should please get up and give the celebrant of today a rousing ovation. But if some virtuous claps, that would also suffice. So very quickly, I will read the citation of our keynote speaker before inviting him to make his presentation.
I'm sorry, I couldn't hear anything. The voice has gone.
Can everybody else hear me?
Yes.
I can hear you.
We can hear you.
Okay,
We can hear
thank
you.
Thank you.
Can you
hear me?
Thank you very much. Can you please mute yourself if you're not speaking? Thank you very much, so that we can have, an uninterrupted event. Ms. Dr. Ayo Shonibare is a consultant urologist and kidney transplant surgeon with over 30 years of experience gathered across several healthcare institutions in Nigeria and globally. Dr. Shonibare qualified as a medical practitioner from the Royal College of Surgeons in Ireland in 1985. He was awarded the Surgical Fellowship of the Royal College of Surgeons in 1991 and worked in the United Kingdom before returning to Nigeria in 1993. He joined St. Nicholas Hospital as a consultant surgeon urologist and rose to the position of medical director in 1995, a position he held until 1999 when he left to set up his own urological center, Vantage Medical Center. One of his key clinical areas of interest include prostate cancer disease management. His current endeavor includes clinical input as Chief Medical Officer for Evercare Hospital, Lekki, a new world-class 165-bed multi-specialist hospital due to open towards the end of the year. Dr. Shonibare is married with 3 daughters, plays golf, lawn tennis, table tennis, and chess. He also swims and plays the piano. Please join me as we welcome Dr. Ayo Shonibare. Dr. Shonibare, over to you.
Good morning, everyone. Can everyone hear me?
Yes, we can. We can hear you.
Yes, we can.
I'm going to try and share my screen, and let me just start off with that. Just give me a second, please.
And to just repeat that if we have questions in the course of Dr. Shonibare's presentation, we should please put those questions in the chat box. And if you actually feel like asking a question that you want to speak out, indicate by raising your hand.
Good morning, everyone. And should I start off by congratulating Major Danmole and the entire family and the Danmole Foundation. I'd like to thank Major Danmole and family and foundation for giving me the honor and the opportunity to actually be part of this program. That was a great prayer by Tunde Gbajumo. May Almighty Allah answer our prayers. Major Danmole I've known for quite some time as a patient, and I tend to connect very closely to my patients. So we've actually become friends. He's a fatherly figure. He's somebody that I respect highly. And I've also gotten to know his daughters. And I must say that I have a lot of respect for the family, because this is what life is all about. The support that we give each other is quite critical, particularly to know that we live in a very, very difficult environment called Nigeria. There's a lot of work that we all need to do to help troubled people, which is a very large population, and it can be, I mean, it's so sad to see people suffering and in so much pain. My talk today is going to be about prostate and other cancers, symptoms, diagnosis, and treatment, and to offer some empowering message for Nigerians. So happy 80th birthday, sir. May God continue to bless you and give you a peaceful, productive years ahead with all the good work that you're doing. Now, just to say a few words about the situation that we find ourselves right now with this pandemic, with the coronavirus. I think all I just want, this is not the subject of today, but we cannot help but mention this. I just want to remind everybody how serious this pandemic is. I think Nigeria right now, there seems to be what I regard as calm. I think we have just a little less than 50,000 cases to date. That's recorded. I think as of last check, it was about 45, 46,000. Now, people may think that, oh, Nigeria is lucky, Nigeria is this, there's something out there. Please, 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 don't let your guards down. This virus is still very much out there. We're seeing different patterns in different countries, and we may not have seen the worst yet for Nigeria. So what I just want to say to you is the social distancing, avoid the crowds, wash your hands as many times as possible. Wear your mask, and please not only wear the mask, but wear it in the right manner. It must cover your nose. this, I can't help to emphasize this because people are dying and you need to be very, very careful. Please don't go. I'm happy that the family is doing this rather than gathering together. But you know, as you all know, the churches and mosques are supposed to be open soon. Please, I will not advise anyone at this time to go to any crowded place. You can pray in your homes. It's just a word of warning. This is very serious. Now, cancer. When we hear the word cancer, it's a world of despair. I mean, cancer, whenever you hear that, your heart kind of sinks. And you think, oh dear, the world is about to end. It can be painful. Treatment can be very expensive. It's a long journey. And, but just to say that it doesn't mean that it's the end of the world. There's a lot of good treatment available today for cancer, and people with cancer are living long lives. So this is about prostate and other cancers, but I'm going to focus on 4 cancers, the commonest cancers, because it's difficult to cover all the cancers in just 30 minutes. Now, just in terms of the global burden of cancer, it's a sad case. It's increasing exponentially at an alarming rate. And if you look at Nigeria, which is relevant to us, we're recording about 115 to 120,000 cases per year, and mortality is pretty high, about 60%. So we have roughly about 70,000 cases are dying every single year from cancer. So this is it's quite challenging. If you look at the burden in Nigeria, for men, you can think of the big 2, prostate and colon cancer, and for women, breast cancer and cervical cancer. If you look at the global map, and if you see the terms of incidence, you will see that Nigeria is, for males, you see Nigeria is green. Green is for prostate. So that is what is showing big in terms of incidence. And if you look at women, you will see breast is purple. And if you look at Nigeria, Nigeria is purple. So this is from World Health Organization. So for men, you can say by far, prostate is the most challenging, it's the commonest, and it also causes the most deaths, which you can see in this other graph. Just this is mortality. So if you look at Nigeria, what type of cancer is killing men the most? Again, green is Nigeria, prostate is green. Again, with women, what is killing women the most? Purple is breast, and if you look at Nigeria, that's purple. So now, basically, in terms of deaths, yes, the incidence, because in Nigeria, even if you're diagnosed with cancer, getting treatment is a challenge. And it is predicted by 2030 in sub-Saharan Africa, the cancer cases will rise to about 787,279. This is a 77% increase from 2010. So just to say that this is going to be quite challenging. Now, if you look at these statistics, I mean, it's quite alarming to know that 14 Nigerian men die daily from prostate cancer, and 1 Nigerian dies every 2 hours from colon cancer. That's I mean, if you think about it, it sounds pretty alarming. If you look at women, 30 Nigerian women die every day of breast cancer, and 1 Nigerian woman dies every hour of cervical cancer. So this is something that is killing a lot of people. And the sad case is, if you talk about treatment for cancer, you will be saddened by this statistic that we have only 8 radiotherapy centers, radiation treatment in Nigeria, where WHO is recommended that we should have 180. So listen to that. Isn't that sad? 180 and we only have 8. Now, with cancer treatment, there are different modalities, largely surgery, chemotherapy, which is injection of some drugs, and then radiation therapy, which is a special machine which shines some rays to try and destroy the cancer. And Nigeria has only got 8 in the entire nation, when we should have 180. And other factors that contribute to poor outcome is this culture of silence. Nigerians don't like to tell people that they have cancer. And they think it's but they should tell the loved ones so that they can get help. But in terms of healthcare facilities and infrastructure, we all know, sadly, that our healthcare is actually struggling, and there's a lot that needs to be done. I'm quite passionate about improvement of healthcare, and I'm spending a lot of time devoted to that, which we'll get to hear later. In terms of cancer symptoms, I mean, there are numerous symptoms of cancer depending on where the cancer is, and it varies from pain to vomiting to weight loss to a lump to bleeding. I mean, there's so many, and cancers can occur anywhere in the body, basically, and what people present with will depend on the organ that is affected. But basically, whenever cancer comes, in terms of diagnosis, we take a history, we do an examination. If there's a swelling lump, you try to take a sample of the lump, which is called a biopsy. Once you get the results, then you need to do all kinds of investigations like radiation, like blood tests, because you want to know how far this cancer has spread. The thing about cancer is it starts somewhere, and then it begins to spread to surrounding tissues. And after that, it goes into the blood and the nodes, the lymph nodes, and then it spreads to other areas. But cancer today in developed markets has got a lot of solutions. There are different treatments available for cancer, from immune system, enforcement, to radiation, to special drugs that target the cancer, to chemotherapy you've heard of, from transplantation for bone marrow cancer, surgery, and different hormone therapy like for prostate cancer. So cancer treatment is advanced. I'm showing this slide, which is a very sad case, because many years ago, during the Yar'Adua time, there was this center that they wanted to build in Abuja, a 10 billion naira project. And this was meant to be a huge comprehensive center. They were getting help from the US. And sadly, like most sad cases in Nigeria, the picture you see is brown grass. So what it means is that they put on those structures at that time, and this is what it looks like today. So this is an abandoned building after spending 10 billion naira, and this is what it is. So there's nothing happening there right now. So in terms of cancer screening, there are different things that we all need to do at different ages. And the cancer I'm going to focus on, the prostate, colon, breast, and cervical. For prostate, from the age of 40, people need to do their PSAs every single year and get a rectal exam by a urologist. Colon cancer, colonoscopy from the age of 50 every 10 years, but there's a stool test, which you should also do every year from the age of 40. That's called a fecal immunochemical test. And that can detect tiny little blood in the stool, which may signify that there may be some cancer. And then you then go for the colonoscopy. Colonoscopy is just looking into the large bowel with a telescope. That's what colonoscopy is. It's a straightforward test. I've had mine done when I was 50. So it's important that people do this. I get to see a lot of patients in my clinic, and I ask them, have you done this? So people don't even know what this is and say, whoa, what are you talking about? So breast cancer, of course, mammography, a lot of women know about that. In high risk of family history is done annually, but if there's no family history, it can be done every 2-3 years. Of course, cervical cancer, pap smear, HPV, women should have this done every 3 years from the age of 21. Now, I will show some historical slides just to remind you of how Nigeria was at some period. This is the time of Awolowo. It's a shame that this man was not given the opportunity to do something at that time, but I'm sure he would have done much better than what we see today. There was also evidence. Can everybody hear me? There was some kind of interruption there.
We can
Am
hear
I
you.
okay?
We can hear you, yes.
Am I going too fast?
No, you're fine. You're fine. Thank you.
Okay. So Awolowo, there was also evidence that he also suffered prostate cancer before he died. Now, prostate cancer, the prostate gland, this is just a picture of where it is. It sits below the bladder. It's a little gland, and it doesn't do much work except secrete some fluid to protect and preserve sperm. So its function is not that critical, but it can be a lot of nuisance. So if you look at the certain myths and facts, diet, yes, high-fat diet can increase the risk of prostate cancer. Yearly PSA test is essential from the age of 45. That is true. Prostate surgery will end your sex life and cause urine leakage. That is false. Only elderly men are at risk of prostate cancer. That is false. High PSA means you have prostate cancer. That is false. If you get prostate cancer, you will die of the disease. That is a big false. So the facts, this is something that develops in the prostate. It starts off by some abnormal cells that grows and it gets bigger and bigger. 70% of cases you find in men older than 65 years. Incidence in Nigeria is pretty high. It's the most common cause of cancer death in Nigerian men older than 50. Now, it tends to spread to different places, but typically the bones. So this is the commonest cause of lower limb paralysis in Nigerian men older than 45. So if this is not detected early, it spreads to the spine and it causes paralysis. So this is why it's so critical to make sure that one detects it very early. The incidence is high in African, Afro-Caribbean, and African Americans, and mortality is also higher compared to Caucasians. So in terms of the incidence, this is so common that 1 in 10 men will develop the disease by the age of 65. And Black men are more likely to present with advanced disease compared to Caucasians. Now, these are people that have had prostate cancer. And somebody I would have included is Wole Soyinka. He announced his own publicly. So I guess it's okay for me to mention that because it's let the whole world know. But Wole Soyinka is in good spirit. He's been treated and is still active and moving around. Just to let you know that this disease doesn't mean it's the end. There are numerous symptoms. The symptoms, basically urinary symptoms, but important, it may not present with any symptoms whatsoever, which is the reason why people need to get screened and tested. And the rectal examination of the rectum, the anus, is not painful, so there's no need to be scared about this examination. The detection tools, as I mentioned, blood tests, the rectal examination, and then if this is diagnosed, there are other modalities of investigations to know how far that this disease is spread. Now, why do we screen for prostate cancer? Basically, if you screen and you detect this, then you can treat early disease and people live a much better quality of life. If you look at the relative risk of getting prostate cancer, family history is a big one. So if a family member has got prostate cancer, there's a high likelihood that the children, male children, of course, will also get prostate cancer. If you eat the wrong things, like high fat, it increases your likelihood by twice. If you're obese, that's if you're overweight, if you eat too much dairy products, animal fat. So those are things that can actually increase the likelihood of prostate cancer. In terms of the treatment of prostate cancer, it's quite advanced today, from robotics, using the robot to do the surgery, which is a very precise computer assisted. There's also injection of hormone, radiotherapy, radiation treatment, and chemotherapy. These are all very effective treatment of prostate cancer. The thing about prostate cancer is if it's really advanced, you don't treat it and you don't catch it early, then you can run into problems, and advanced disease is very, very difficult to treat. There are not too many options for treatment of advanced disease. So the key message here is catch it early and treat it, and the result will be quite good. These colorful fruits are fantastic. So if you don't eat any of this, please start eating the very good antioxidants as a prevent. So in terms of as prevention, the way forward for prostate cancer, early detection, early diagnosis, education, and then there's a lot of research going on locally. Now, there's a patient of mine that I have patients for almost every single cancer I'm going to discuss today. Prostate cancer, just to mention to you, this is an American, white Caucasian American that saw me in 2015, who came with PSA over 9,000. PSA should be less than 4. This man came with PSA over 9,000. Just to let you know that he had advanced disease at that time. His PSA even rose to 13,000, but he's under treatment. And the good thing is that he's very active right now. He still jogs and is living a very good quality of life. The reason why I want to mention this is to tell you that even advanced disease, if you have very good treatment, it's not the end of the world. So that's why now, again, Nigeria of those years, look at how neat and how clean. I think this is Ibadan, New Court Road. Now, colon cancer. So colon cancer, how does it present? Weight loss, blood in the stool, change in bowel habits. So all of a sudden you start complaining of diarrhea or constipation that you never had before. And this often starts as a little growth in the colon that we call a polyp. If you detect this early, then people can do well. This is just a diagram of the large bowel and showing you that polyp in that diagram. In terms of colon cancer facts, again, like I said, 1 Nigeria dies every 2 hours from colon cancer. But if you detect this early, 5-year survival rate in early detection is greater than 90%. So which means we do cancer survival by 5 years. So it doesn't mean that they only live 5 years. What it's saying is that at least 5 years, more than 90% are still alive if you detect this early. Now, the risk factors, again, this is fairly common in Nigeria today. People older than the age of 50 have a risk, and there's some dietary factors as well, and family history. The screening is done by a fecal occult blood test, or there's a new test now called fecal immunochemical test. This is just a stool test that you submit to the lab, and it has a high detection rate for tiny, tiny little blood in the stool, and it can detect this early. Colonoscopy, like I said, I've had mine done. Once you hit the age of 50, you go for colonoscopy. If everything is clear, you don't need to do it again for another 10 years, unless you have a strong family history and then you need to be more frequent. So this is colonoscopy, just showing you, it's just a telescope that is, you get a sedation, something to put you to sleep. And I mean, it was a very pleasant experience for me. I didn't even know anything was happening. And then they take a look, and then it tells you if you see the tiny little growth, you can remove it. So now, in terms of treatment for colon cancer, again, surgery, you can take the cancer out, and then you can also give injection chemotherapy, and in some cases, you may need radiation treatment. So this is, again, an example of another case that to discuss with you, a 59-year-old lady, 20 just last year, She had never been screened, and then she was asked to go and get a colonoscopy when she was complaining of lower abdominal pain. They found colon cancer, and to worsen the situation, when they were then checking to see whether this had spread, she had other tests that detected bone cancer. So two different cancers at the same time. But just to say that she was about to go to India, but pandemic struck. But to let you know that she now she's receiving treatment in Nigeria now by pulling a lot of talent, clinical talent together, and she's doing extremely well. She's had surgery for the colon cancer. She's now getting chemotherapy for the bone cancer. She's in good spirit. She's back at work, running up and down. So again, just to let you know that it doesn't mean that yesterday is history, tomorrow is a mystery, but today is a gift. So you can just know that it's not the end of the world. Again, look at Nigeria in those days. See how neat, and people riding their bicycles. It's sad that we can't do anything like this anymore. Very, very sad. So let's move on to breast cancer. Now, breast cancer are very, very common in women. You can also get it in men, but in terms of men, it's not as common. In men, breast cancer in men accounts for 1% of all breast cancers. So it's not that common in men, but men can get it as well. This is again family. Family history is a strong one. So if anyone in the family has got breast cancer, then the female in the family will need to ensure that they keep on the watch. The risk factors, I can't go through in the interest of time, the entire risk factors, but the most important thing, like I said, is this family history and age. People older than age 65, they have a higher risk. And again, if this is detected early, if anyone feels a lump, they need to get it investigated. Nipple discharge needs to be investigated. Nipple pain has to be investigated. And early detection, early treatment is the way to go. So in terms of breast cancer screening, mammography from the age of 40 should be done every 2 years, and on average. And it used to be every year. But if there's a high risk, family risk, then it could be done every single year. So again, with cancers, we like to know exactly what it is. So we can do what is called a biopsy with a tiny little needle or fine needle. You can even start with a fine needle smaller than the one shown in there. If you have a good laboratory, they can detect the cancer cells. And then you do x-rays and MRI if you detect that there's cancer. And then in terms of treatment, of course, surgery, hormone treatment, then chemotherapy, radiotherapy. It depends on the stage of the disease, will depend on exactly what you need to do. Again, to just show you another case, this is a 37-year-old lady that I saw in 2018 that came to me. And a lot of people come to me with all sorts of problems. I refer them. There's some that, even though I'm a urologist, but sometimes people just have this trust. And then once I get it like in this case, when she was diagnosed with the breast cancer after a needle, she was sent to a specialist cancer. So it's not to say that I'm treating all these cases, just to make that declaration. I don't treat the cases. And sometimes I actually even see them and say, oh, you need to see so. And they ask me, can't you just do this biopsy? So, but as much as possible, I send them to the specialists. I don't delve into areas that I'm not proficient at. So with her, she had this biopsy done. Unfortunately, she had gone to different centers that gave her wrong diagnosis before she came to me. And when the diagnosis was made, she had initial treatment in Nigeria and then went to the US for other treatment. But just to say, at this young age of 37, the cancer was so aggressive. She had both breasts removed, and then she had spread. So she had chemotherapy, she had radiation therapy, but one thing is she's been trying to go for fertility treatment because she doesn't have any children yet, but she's now adopted and she's psychologically in a fantastic place. So she's very happy with her adopted child. She's doing very well. She's back at work. She's feeling strong and she's bouncing and very happy. So cervical cancer, this is another one that is very common in Nigeria. You can see the cervix, and if the cancer erodes, it actually eats the surrounding tissues. Just showing this right here. So you can touch the bladder and also all the tissues around. This is very common. The sad thing about this is that this tends to present very late because not enough women are not doing pap smears on a regular basis. So people with, and then there's also HPV, which is the virus that causes this largely. There's a vaccine available now. A lot of women are not getting their daughters vaccinated. So this can actually prevent disease. And this is something that's recommended for both boys and girls from the age of 11 to get this vaccination. But the thing with cervical cancer, it starts very small with something we call carcinoma in situ, just a tiny little abnormality in the area. And then it takes like 10, 15 years to develop and then becomes very aggressive. So pap smear can pick up the early stages of disease. And if pap smear picks it up, then the patient can be treated at that time before it becomes really aggressive. Like I said, unfortunately, by the time the women are presenting, it's actually pretty advanced. So the pap smear is important for women to get this done. It's again a straightforward test. It's not unpleasant. So it's very important that women get this done on a regular basis. So basically, it should be done every 3 years, the pap smears, but if there's a family history, then it's best done every year. This screening should begin very early from the time the women become sexually active and not later than 21 years of age. So in terms of symptoms, like the early disease, no symptoms, which is why the pap smear is important. But advanced disease is actually very unpleasant. That's when people can present with vaginal discharge, pelvic pain, low back pain if it has spread, and they can have bladder, urine symptoms. They can also lose blood and become anemic. And they can lose weight as well. These are advanced disease. How do we investigate this? You do the biopsy, taking a sample and sending it for analysis. You do CT, chest x-ray, so imaging, you do blood tests just to know how advanced the disease is. And in terms of treatment, of course, you remove the entire uterus, hysterectomy, and then radiation therapy, chemotherapy, immune therapy. So in terms of prevention, again, waiting women to be waiting a bit before, to be older before intercourse, because you find that they had a number of sexual partners, they had the risk of getting this disease. And even when people are going to start intercourse, it's good to get vaccinated against this virus, and that protects the disease. Now, this is another case, example of cervical cancer. Again, a patient that came to me in 2006, who at that time, she had had treatment in the US in 1996 for cervical cancer. A case, she had the entire uterus removed, and then, but subsequently, she came even in 2010, she had a leg swelling, a complication of the cancer. It had spread and affected the kidney. So she had to have a tube put in to relieve the obstruction of the kidney. Anyway, the summary of this story is that she was managed then I did some of her treatment because of the kidney involvement, and then she also had treatment in the US. She had chemotherapy, radiation, but to let you know that this woman is still alive today. Her 2 daughters just got married. So you can beat cancer. And then it's just important to know that this depends on your passion, your motivation, your will to live, your spirit to fight the disease. So now I'll leave you with some empowerment messages. So there's a, cancer, C-A-N. So there's a can in cancer because we can beat it. You can get treated, you can get early detected, and you can do very well from treatment. So it's not all doom. There's also need for awareness, which is the major thing in Nigeria. There's not enough awareness. Those of us in the medical community are a bit guilty because there's need for us to do a lot more work and make this known to people, the time they should be screened, the time they should be tested, the facilities that are available to treat. So awareness and education is quite critical. We need to do a lot more work in that direction. Early detection with screening, prostate, PSA, mammography, breast, pap smear, cervical, colonoscopy for colon cancer. It's very important that we inform our family members. If they've not done this, they should do it. And for the screening for different cancers, I've just highlighted, which I had mentioned a bit earlier, in terms of the frequency that the tests are done. But this frequency will increase if there's a positive family history of any of these cancers. This is more or less to show that if people are treated very, very early, the results are very, very good as cure. So if they're detected early, they're treated early, it is as good as cure. It's only when people are not detected early and then you are struggling, but the treatment is still quite good. So a rule of thumb, get the facts, seek out support. It's a long journey. You need family support, you need friends to support. It can be quite expensive, so you need financial support, financial aid. You connect with your care team. It's important to stay close to doctors when this happens because they will help you out in ensuring that you get quality care and good treatment. Exercise is important. Good diet is important. Important not to gain weight, not to eat the wrong things. So now family is quite critical. And I must say that I'm very impressed with Major Danmole's family. This as they come to the clinic with him, they give him that emotional support. It keeps him smiling. That is what life is all about. So family, then we need to do a lot for our loved ones, friends, spouse. So the cancer news is difficult. It's difficult to consume, but if you see Major Danmole in the clinic, it comes in full of life and doing extremely well. Now, COVID-19 and cancer care. Now, the COVID-19 is a major issue in Nigeria, everywhere in the world. What is happening right now is that because of COVID-19, people are not getting treated with cancer. So because they're not getting treated, the disease is now advancing. So this is going to create a major issue for us in that you will get post-COVID people turning up with advanced cancer. But it's just to let you know that there's still hospitals there that can manage the issue of COVID-19 and still see patients. A lot of patients in Nigeria are now reluctant to go to hospital, but that should not be so. If there's a problem, you need to go to hospital and get checked. Just make sure you go to the right hospital. There are several foundations that are actually doing a lot of good work. An error on my part, apologies. I ought to have included the Danmole Foundation on this slide, because they're also doing a lot of good work, and commend Major Danmole for that. Now, this is the new hospital I'm involved with. It's going to open before the end of the year. We're going to treat cancer. We will not have radiation treatment, but we'll work with a partner to do the radiation. But we'll do the surgery, we'll do chemo. A lot of this is a really, really great project. Foreign investors, Nigerians will be very happy. We're going to be patient-centric, and we're going to be it's going to be compassionate care. And we're going to do a lot of work. We've started, and I can assure you we will do what we promised to do. I will be the chief medical officer and ensure that patients get good outcomes, because that's what Nigerians deserve. There's some other new hospitals coming up. There's a Luth Cancer Center, which was opened sometime last year, with good facilities, but in terms of management, it's not run by Luth, it's run by a private organization. They have some challenges right now, but in terms of equipment, they got very, very good equipment. Lakeshore, you may have heard of. Then there's going to be a new center coming up in Victoria Island that will open before the end of the year, which will have comprehensive cancer care. So things are improving slowly by some initiatives, but the fight continues, and we have to continue to support the fight against cancer. And never stop believing in hope, because miracles happen every day. Better times ahead, and just to let everybody know that there's help out there and you can get very good results. Thank you.
Wow, thank you very much, Dr. Shonibare. That was indeed very insightful. Just before I do a summary, because I took some notes, I would like to assure participants that the slides would be made available, because I've seen some questions in the chat box asking about the slides. So to do a quick summary for the benefit of those who joined us after Dr. Shonibare had started. Cancer is not a death sentence. I think that went throughout his presentation, but early detection is critical. Prostate and breast cancer are the most common forms of cancer in Nigeria. He told us they're very grim statistics, but I think it's good for us to know and be aware of those statistics. 14 Nigerian men die daily from prostate cancer. 1 Nigerian dies every 2 hours of colon cancer. 30 Nigerian women die every day from breast cancer, and 1 Nigerian woman dies every hour from cervical cancer. Cancer treatment is an advanced stage in many parts of the world. He also spoke about screening and testing for each type of cancer. He demystified some of the myths associated with cancers. There were quite a few of them. You know, he sort of helped us to put those in context, and again emphasized the fact that early diagnosis and treatment are critical to living a bountiful life even with cancer. There's some nuggets that he shared, one of which is that yesterday is history, tomorrow is a mystery, and today is a gift, which is why we're celebrating Major at 80. He also said that there is a can in cancer, meaning that it can be beaten, provided that it is detected early and treatment commences early as well. And in closing, he said, and for me, I think this is very important, that family is critical even to the treatment and successful recovery or living with cancer, because love and care and the support of family is priceless. So we'll take a few questions. I have a couple of my own as well, and then I have seen a few in the chat box. The first one that I have, Dr. Shonibare, if you permit me, is the fact that from all that you've said and from some of the things that a lot of us have read, it would appear that treatment of cancer is expensive. Can you put this in context for us? You know, so there are lots of people who will want to know about how expensive is cancer treatment, not to necessarily give us actual, you know, details of the naira and kobo, but just to give us an idea, how expensive is cancer treatment?
Yeah, sure. Yeah, I mean, it's okay. It's okay to even give some facts
Okay.
because really the thing about cancer is that just you can think of it broadly as three categories in terms of treatment, depending on how early that it is detected. So these categories involve surgery. You want to remove the cancer. Then it also, if it's detected early, you will just need that surgery and you're not going to need anything else. Now, then you now come to chemotherapy, which is injection of some drugs to basically for stages that have moved beyond the early, that have involved some of the other surrounding immediate structures. So you inject, in addition to the surgery, you inject some drugs, which is chemotherapy. And then radiation treatment, again, for advanced disease, when the thing has spread beyond, and some cancers, you actually primarily treat them with radiation, even without surgery. So in terms of treatment, surgery typically in Nigeria today, in the good hospitals, you'll be talking about total bills ranging from 1.5 odd million to 3 million to 5 million, depending on the extent and the complexity of the surgery. Now, in terms of chemotherapy, depending on the type of cancer, chemotherapy costs can range from your thousands to several millions. So, I mean, some of the drugs used for breast cancer chemotherapy, they're very, very expensive. So on the long term, you will end up spending millions. But the millions is not that you're spending it in one shot of chemotherapy. So one chemotherapy session may cost you the 200,000 to 800,000, but you need several sessions. Now, radiotherapy treatment in Louth is this new center is about 750,000, which is really, really, really discounted. In Ghana, it's $10,000, so that's 4-point-something million in Ghana. The same kind of treatment. In the developed world, treatment will range from 20,000 pounds, 30,000 pounds. So those are the sort of costings. So this is, I hope that answers the question.
It does. Thank you very much. So if I put it side by side with the, the reassurance that one continues to get that cancer is not a death sentence, there are people who honestly cannot afford those figures that you have mentioned. So to them, what's the hope? I mean, I know that you mentioned some foundations, including our foundation, but is there any support from government, perhaps, in treatment of cancer for those who cannot afford to go to the private hospitals?
Well, that's a good question. Now, the sad story about Nigeria is that the kind of costing that the lower socioeconomic group can afford, well, they can't really afford much, but you're talking about our public sector. So this treatment that is 750,000 in a public sector setting, you could be looking at perhaps maybe 150,000, 200,000, but that is so poor quality. So, the sad thing is that, which is so sad, you see, every human being deserves the right to good health care. That's a common thing that I don't understand why our government cannot reason and do something about that. And, for personally, I weep inside me when I see poor people go through pain. And I literally weep. And I do it in myself painfully and I've struggled for a long time because I've struggled to think, why as Nigerians are we like this? And I've been doing a lot of research, and I came across one reading by someone because, for me, I couldn't rationalize it. And I came across this statement by Pius Adesomi, who is late now. He died in some plane crash. Now, he said, because I can't understand why things are like this in Nigeria, to be honest with you. And this guy said, a lot of our elites are ruling so-called elites. They actually suffer from something. And what is that thing? Contempt for philosophy and critical intellection. I repeat, contempt for philosophy and critical intellection. I've never forgotten that till today, because I can't explain it. So to answer your question, the poor, the underprivileged, they're suffering and they're in pain. And I just pray to God that someday God will give us some good leader that has got philosophy and can reason and think why human beings should not suffer. So it doesn't answer that question, but to be honest with you, they struggle. And apart from your foundations and the poor quality public sector, they need to go around and borrow and beg and for amongst family members.
Absolutely. Thank you very much. I mean, I thought that was the case. I just wanted you to give, some clarity in that regard. There's a related question. Okay, so we're talking about treatment. What about detection? Does government help in any way? Is there subsidized screening that government provides?
You see, I'm very blunt when it comes to government. And sometimes, we're not in military era, so they're not going to pick me up. The government has failed to deliver for the people. And honestly, there's nothing that they're doing. They have failed woefully. And our public hospitals, you don't even want to go there. I'm telling you, I've been to some of these places. They have failed. Government is not doing anything. That's what I'm going to say. Because I cannot commend them for
what they
the
haven't
present
done.
scenario. I can't. And if they will pick me up, so that's fine.
Yeah, that's fine. So I guess we have to rely on foundations and NGOs.
And private sector. Foundations and private sector.
Private sector. Thank you. I have a question here. You had said earlier on that it's good for men 40 years and over to periodically test for prostate cancer. Is it unusual? I mean, what's the probability, can I say, of somebody under 40, showing signs or symptoms or actually are having prostate cancer?
Okay, that's a very good question. What I will say is that it's unlikely, very, very unlikely. Now, the funny thing about cancer, though, is that sometimes some families have very strong genes for cancer. And this is something we've seen. Now, and what I mean by that is I've seen a family, every single member has got some kind of cancer or the other. Now, in that kind of family setting, I would then say to a male in that family, you better start testing from the age of 30. But this is not something that is common. So it's not something everybody should start testing from the age of 30 for prostate. 40 in the US, they do from 45, 50. But because prostate cancer is very common in Africans, Afro-Caribbeans, and African Americans, we advocate testing from 40.
Okay.
Yeah.
So that takes me to my second question, which is related to what you just said now about the preponderance of cancers in Africa and this part of the world. Why is that? Is that because of our diet? Is it something with our chemistry? Why is that?
Okay, that's a very good question as well. And it's all of the above that you mentioned. Number one is diet. We're eating the wrong thing. We've moved to this Western style, from the original diet, very healthy diet that is now Western lifestyle. It's all fried and fast food. And so we're consuming a lot of bad things. Now, environmental pollution is also to blame. A lot of pollutants dumped into our waters. I don't know whether everybody knows that or not, I mean, they dump radioactive waste. You know, Nigeria, all these corrupt people will take things that they cannot dump in other places in the world. They come across here and some money, you know, exchange of money, and they allow these people to dump. That's 2. Lack of exercise is 3. Genetics is 4, because there's some genetic preponderance to getting certain types of cancers. So if you happen to be Black, getting prostate cancer is high on the list just because you happen to be Black, so, or Nigerian or African. So there's diet, there's lack of exercise, there's the environmental pollution, there's the genetics. Yeah, so all those things, they're all contributory.
Thank you very much. My last but one question, what are the side effects of cancer treatment? I mean, some of it is in the open, is out there, but we'd just like for you to share with us, what are the major side effects of treatment?
Okay, basically, in terms of side effects, everything we do in healthcare has got side effects. I mean, drugs we take has got side effects. Now, my saying with this, when it comes to side effects, is that you look at the benefits and you look at the risk. So the side effects fall under risk. So the benefits in cancer outweighs always the risk. So in terms of those benefits, you know, if you look at those side effects that people want to know, for instance, if you look at breast cancer, to say that cosmetically a woman is going to lose her breast is not psychologically, it's tough. Now that's the side effect, the psychological trauma. But look at the benefit of saving her life. And so depending on whether you're having surgery has got some side effect. Like for instance, in prostate cancer, if you remove the prostate for prostatectomy for prostate cancer, some men may suffer erection problem. But again, you look at the erection problem and you look at life. And then you say, okay, in terms of side effects, do I live with erection problem, which we can treat with drugs, or do I die? So again, if you look at chemotherapy, which is another form of treatment, the drugs can make you vomit, it can give you nausea. But again, you look at that side effect, the drug will save you and give you additional years, but the unpleasant side effect, like vomiting, you try to tolerate, and we have drugs to help. So if you look at radiation treatment in certain areas can cause skin discoloration. Your skin can darken. But again, if you look at that, taking your skin to darken versus dying. So if you give radiation, let's say for prostate around the pelvic region, it can cause you to have a little bit of diarrhea. Again, that's temporary. That's a side effect. So would you rather have that diarrhea side effect and live for many more years? So everything has side effects. The important thing is that the side effects will need to be managed. And we do have drugs and various modalities to deal with side effects. Yeah.
Thank you very much. I'll encourage one or two people, if they want to raise their hands, if they want to actually ask questions. We'll give the opportunity to one or two people. But I also have a question here. I was not planning to ignore it, but the question has been asked now twice, so I will read it out. It's a myth, so the person wants to know whether it is true or not. Sir, how true is the myth that regular sex can help prevent prostate cancer and breast sucking as well? I'm keeping a straight face, as you will notice.
Yeah, but let me clarify this, because I get asked in my clinic quite a lot. Now, and let me tell you where the myth is coming from. So let's take the one of prostate cancer. Now, it has been shown that that myth is actually, it is a myth. But the story behind sex and prostate cancer. Now, sex with multiple partners, I repeat, sex with multiple partners will increase the risk of prostate cancer. So, because it is believed that there may be some viral transmission here that may increase that risk of getting prostate cancer. Now, sex with the same partner does not increase, it does not increase the risk of prostate cancer. Now, multiple sex with the same partner, there's no scientific evidence that it reduces the risk of prostate cancer. Those are the facts, and facts are facts. Now, with breast cancer, it is known that if women don't, the women that don't breastfeed, or they're not married, so it doesn't even come on, there's an increased likelihood of breast cancer in women that don't breastfeed. Now, that does not equate to sucking, which is a completely different altogether. Breastfeeding babies is not the same. So that is also another myth, and there's no scientific evidence to prove that that is the case.
Okay. Thank you very much. I think we can only take one more question. Time is far gone. How early can stomach cancer be detected?
Well, stomach cancer, not as common as it is in the Japanese, and they eat a lot of salt. It's been shown that that is one of the etiological factors, eating a lot of fish, well, salty fish. Now, stomach cancer in terms of early detection, that we don't do like some regular screening for stomach cancer. The important thing is that symptoms, what is important is a lot of Nigerians go on with symptoms for years without telling anybody. So if anyone is having pains in the stomach, particularly in the middle, just below the chest, that middle where everybody we know as where our stomach is. If you're having pain there, if you're losing weight, which is advanced, when people start losing weight, things are advanced. But if you're having pain, or if you notice some change in your bowel pattern, or you notice some change in your stool, let's say the stool is dark, because stomach cancer can bleed and it will come out in the stool as dark. So if you see any of those things, you need to seek help, and that is where it will be investigated and detected early. So with regards to stomach cancer, one of the early signs will be some discomfort. And when that discomfort comes in the middle, people should get endoscopy, the camera that will be put from the mouth into the stomach to see what is going on there. You know, sometimes a lot of people think, oh, this is ulcer. They even diagnose themselves, I have ulcer, and they start taking anti-ulcer drug. That is wrong. You need to get that pain investigated. It is not ulcer until it is proven and diagnosed that it is ulcer. It may be stomach cancer.
Thank you. Thank you so much, Dr. Shonibare. We cannot thank you enough. The questions still continue to come in. Unfortunately, we're running out of time. Just to reassure those who are asking that the presentation slides will be made available. I also now at this point want to encourage participants and all those who have signed on this morning that the celebrant would prefer that if you want to give gifts, you should please channel those by way of cash donations to the foundation. We will shortly be sharing details of the foundation's account. It's obvious now that there's a lot to be done. Government has woefully failed, and it's not new. We know that already. It's just a confirmation that we have. There's a limit to how much private hospitals and NGOs can do without the support of all of us. So I'll please enjoin you that you please make available the account details of the foundation, and that instead of gifts to the celebrant, you please make your generous donations to this foundation, so that we can, in our own way, help those who are in need, who have been diagnosed with cancer, and even to help them test for cancer. So just before I invite the celebrant for his remarks, I would ask that we all please turn on our videos and our microphones, so that we can sing a birthday song to the celebrant. I will ask somebody who knows that they have a good voice to lead us, to volunteer to lead the birthday song. Lope, do you want to? Lead us in the birthday song? Okay. So 1, 2, 3, go. Lope.
Happy birthday
to
you.
Happy
Happy
birthday
birthday to you.
dear Major. Happy
May the good Lord bless you. May the good Lord bless you. May the good Lord bless you. Happy Thank you. Happy birthday,
Happy birthday,
Daddy.
God bless you. Happy birthday. Happy birthday, Daddy.
Bisi, my darling. Dr. Shonibare, the man who brought me back to world. My friends, my relatives, my family, I thank God for giving you the opportunity to arrange this lecture. To awareness for those who have not been affected with a prostrate problem. I have been affected with prostrate problem, and I thank God to have brought Dr. Shonibare to my life. He did a wonderful work. The essence of this outing is to create awareness to everybody that we should not take things for granted, that, oh, I'm hale and healthy. I was hale and healthy. I didn't know that I had prostrate. I just felt that it's just a change in my system. But now, I thank God I'm very much okay. Thank you for being part of my celebration.
Amen.
Allow
Thank you. I will look forward to attend your 30th birthday in near future. And for those who are...
Oh, bless. Yes, we couldn't hear you before, but I can hear you now.
Okay, should I start all over again?
No, just towards the end.
No, the start. No, sir, Baba.
Okay, thank you very much.
So my own problems and for my adults who are 80 plus, please accept me in the Octogenarian Club. Thank you very much. God bless you.
Choice.
I wish you all the best.
You are welcome.
Thank you very much. Thank you very much, sir, and happy birthday once again. To share with us the vote of thanks, I will now invite Mrs. Olalungbe Atunrashe.
Good afternoon, everyone.
Good afternoon.
Good afternoon.
On behalf of the Kehinde Danmole Foundation, I thank everyone that has dialed in to this lecture. Most especially, I thank the keynote speaker, Dr. Shonibare. Thank you so much, sir, for being such a great support and for delivering such a fantastic lecture. I thank you, Auntie BC, my big sister, for being a great moderator. And I thank God most especially for my dad, for giving him the grace to see this day. We give God all the glory, and thank you. And we look forward to celebrating many great things in future. Please keep safe. God bless you. Bye-bye.
Thank you very much. Thank you very much, Lungbe. Like I said, just to share with you the details of the foundation's account, for those of you, and I will encourage all of you to please do so, who would like to support the work that we do. The account details are Access Bank 001-741-7028. Kehinde Danmole Foundation, Access Bank, account number 001-741-7028. I thank you all for attending today's lecture, and I trust that you have taken a few things off that what Dr. Shonibare told us. Cancer is not a death sentence. Early detection is critical. As much as we can in our own individual ways, if we can support the work that various foundations are doing, and in particular the Kehinde Danmole Foundation, to help those who are in need, to not only treat the cancer, but to even undergo the detection and the screening. And thank you very much for your time. It's been awesome having you all here. Your love and affection for Major Kehinde Danmole is apparent, and you wouldn't have done this if you didn't love him so much. We'll continue the rest of the celebrations later on in the day. At this point, I say thank you very much for joining us, and God bless.
Like Eagle Diary. The journal, memoir, crime.
Congratulations to Daddy. Happy birthday, sir.
Happy birthday, Daddy.
Happy birthday, sir. Wishing you more years of happiness and great health. Congratulations. Well done, Longpe.
Longpe and Lighton, good job, good job. Auntie Arose, good job, ma. God bless you all.
Happy birthday, Kenda.
Thank you. Thank you all.
Mama Rose, God bless you. We love you.
Happy birthday, Daddy.
Another bit to go.
Happy birthday, sir.
I love you.
Bless you.
Happy birthday, Daddy. Thank you all. Thank you all.
Happy birthday.
Happy birthday, Kenda. From Jamia Ikola.
Yadele. I repeat a story. Modele.
Bros, Kenda.
Happy birthday, Uncle Kehinde. Many happy returns of the day. God bless you.
Thank you, Princess Uwala.
Bros, Kenda. Happy birthday. Auntie Rose, well done.
Hello.
Happy birthday, Uncle. All the big daddies. God bless you for coming.